The U.S. is forming medical teams that will scramble to any part of the country where a new Ebola case is suspected. The Centers for Disease Control Ebola Response Teams, or CERTS for short, are made up of experts who are especially trained to diagnose and treat Ebola. VOA's Zlatica Hoke has our report.
Each rapid response team consists of about 20 members who will be ready to depart within hours to any part of the United States where a patient has been diagnosed with Ebola or is highly suspected of infection.
Well, the rapid response teams are meant to assist hospitals that see suspect Ebola patients. The response teams consist of specialists in infection control, clinical medicine, Ebola outbreak investigation, communications, and a variety of other disciplines, including laboratory.
President Barack Obama ordered the formation of specialized teams after the first Ebola case diagnosed in the United States showed that most hospitals are not prepared to handle the virus. The patient who arrived from Liberia was treated at a hospital in Dallas, Texas, but died on October 8th after infecting 2 nurses who took care of him. The case caused fear that Ebola may spread in the United States, and many Americans have accused health officials of not being prepared to deal with the virus. Mr. Obama said rapid response teams will ensure that proper procedures are applied in all suspected Ebola cases.
If we do these protocols properly, if we follow the steps, if we get the information out, then the likelihood of widespread Ebola outbreaks in this country are very, very low.
The president sought to allay the fears that the deadly virus would spread in the United States. The decision to deploy an Ebola response team will ultimately be made by the CDC director at the request of a hospital or clinic that may need it.
Our Emergency Operations Center has been activated. I think we're in our 106th day of our activation. So the decision to deploy a CDC Ebola response team would lie with the incident management structure. Now, our Emergency Operations Center is our Director's Operations Center. So, of course, all decisions ultimately sit with Dr. Frieden.
Team members are drawn from a list of about 100 health workers scattered across the country. 3 fast teams already have been sent out to New York, Chicago, and Washington. No CERTS teams have been deployed yet, but the first group of 20 is on standby with their bags packed. Zlatica Hoke, VOA News, Washington.